Okay, so I've had Mr. Smith in my care all day today. All of his vitals and everything are within normal range. I have done a safety check, so I'm going to go back in. I just administered a PRN pain medication about 30 minutes ago, so I'm going to see how the effect of that was in lieu of the dressing change. Okay, so good morning, Mr. Smith.
Good morning.
And how is your pain doing now?
Good. Yeah, I don't have any pain.
Okay, and on a scale of 0 to 10?
0.
0? Perfect. Okay. So quickly, could you state your full name for me?
John Smith,
Okay, and your birthday?
January 2nd, 1959.
Okay. Do you have any questions or concerns before I start
I don't think so.
dressing change?
No.
Okay. I'm going to get all set up over here, and we'll try and do as quick as we can. If you're feeling queasy or anything, just looking at the wound, just look away or let me know and we can try and figure something out.
Okay.
So the dressing change expiry date is good and it has not been tampered with. Get rid of this initial drape. I have an ABD pad here. And Mr. Smith, is it alright if I use the bottom of your bed here?
Yeah, no problem.
Okay. And I'm also going to put this drape down just so we don't get excess saline everywhere when I'm irrigating here.
Okay.
So next I'm going to be adding everything that I need into my sterile field. So I have checked the expiry date on this and it is good and I am opening it for the first time. So afterwards I will put the date that I have opened it and the patient name on it. And then at this point I'm going to be taking off the ABD pad. If you're feeling any discomfort, you just let me know. At this point, I'm going to be looking at the drainage, assessing the odor. So at the moment, we have no drainage. And no drainage on those ones as well, and there is no odor. And how are you doing?
Good. Yeah, I can't feel a thing.
Okay. Throwing those away. Change the gloves. And I will assess at this moment as well as after I've irrigated it. So the peri wound is looking good and intact. We have a nice red wound bed, so I'm happy with how it's looking at the moment. And so at this moment, I would, if the patient is unable to turn themselves, I would call for a second nurse. We could position them onto the side, and then we would be irrigating with a 10 cc syringe with a catheter tip on it. I would continue to cleanse with normal saline until the exudate and runoff of the wound is clear. And I would do this until, yes, as much saline is needed. So at this point, I'm going to, just on hand hygiene, I'm going to put on new gloves and I'm going to take some measurements. So initially, I'm going to take the length So we have about a 13 centimeter wound in length with about 3 centimeters width at the widest part. Now I'm going to be going in. Here I'm looking for any undermining or tunneling, and if there is tunneling, I would like to probe as deep as I can go, just so we can keep a good assessment. So at the deepest part of the wound, we're looking at about 2 to 2.5 centimeters. And there's no undermining or tunneling here. So throw this away, and at this point I'm going to put on my sterile gloves. My wound is still wet from the irrigation, so I'm going to have to pat dry that. Give it one more clean, and then we can start. So my tables have already been previously cleaned with Percept. Mindful of my 1-inch border. I'm going to start with my dominant hand. First I'm going to try the intermediate. And you're still doing all right there, Mr. Smith?
No pain.
Now I will be cleaning the outer edges of the periwound. Dry ends or both sides of those dry. And throughout, I will just continuously be assessing the wound. And now I will begin to pack the inside. To use my forceps as a guide. Making sure that we are covering all sides.
Set of garbage.
So another thing to be aware is that I did take out, I will be sure to document that I did take out 2 4x4s from inside the wound and 2 4x4s on top, as well as the ABD pad.
Car, talk a little bit louder.
Sorry, I will be documenting that I did take out 2 4x4s from the initial wound, and that I am putting back in 2 more, as well as the 2 4x4s that were on top as well. Okay, so the wound is looking nice and packed there. Now I will be putting on 2 dry 4x4s to the top. Before I do that, I'm going to get rid of this one just in case. I will be doing skin prep. So at this point, I forgot to add skin prep into my sterile field, but I'm going to call in another nurse to get that done. So I'll either do that by getting the patient to ring the call bell. So she has done that, and my other nurse will come in here.
Oh, hi there.
Hi
I'm
there,
just here to
sorry.
help you here.
Thank you so much.
So here's the skin prep that we're gonna use.
Perfect. If you could open that up for me
I'll
without
just
touching the
open it
inside.
up for you. There we are, and I'll let
Thank
you get
so
that
much.
out. Perfect.
Thank you. I'm going to be cleansing the outside area with that there. That's just making sure that the peri wound is in good condition. Now, as I'm letting that dry there. Being cognizant that I am also putting in two 4x4s into the middle of the wound, as well as two 4x4s on top. And I will be finishing with placing an ABD pad. Onto the top there. And you're still doing all right there, Mr. Smith?
Yeah, that was fine.
Okay. At this point, I can take off my sterile gloves. And I will begin taping. And at this point, I have finished the wound change. I will go immediately and do my documentation. And thank you very much for your time.
Thank you.
And how did that feel?
That was fine.
That was
yeah.
good? Okay.
Totally fine.
We'll pack up and then we are good for the day. One.
Thank you.
You're very welcome.
Done.